Welcome friends. Today in this lecture I am going to present an outline about genetic counseling and its importance. So in this genetic era, understanding of DNA or gene regarding genetic conditions, variabilities, mechanisms and contributions to common diseases grew exponentially. Recent large throughput technologies have led to a host of new genetic testing capabilities such as prenatal as well pre-implantation genetic diagnosis. In the same time, less dramatic but equally important and advances occurred in the study of human behavior, public health policies, ethics and in counseling theory. Along with above concerns, humans began to assume greater responsibility for their own healthcare decisions and future offspring health. The activity of genetic counseling developed and changed accordingly over the period. It is only since 1970s, however, that a profession especially devoted to genetic counseling has arisen and gained huge importance in the development of healthy mankind. Let's start with introduction. The development of all organisms, including the human individuals, depends on both heredity as well as environmental factors. For our best development, both heredity and suitable environment are essential segments. The relationships among heredity, environment and health are direct ones, and our ability to understand the science behind heredity in concern with environment affects our aptitude to comprehend the diverse questions regarding eugenics as well as euthanics. Genomic learning will have an enormous potential on the capability to judge risk pretendent to individual or their offspring by their genomic constitutions and environmental agents. In India, more than 50 million individuals are affected with genetic diseases. This number is going to mount up many times as the genetic predisposition in common diseases is more common towards our Indian community. In this DNA age, populace can restore their health and avoid unnecessary therapeutics by help of proper diagnosis with add-on genetic counseling. At present, in India, one of the biggest gains is the openness or availability of the cytogenetic and molecular diagnostic tests for various genetic or inherited conditions. In sorting and or managing above issues, genetic counseling has an enormous importance. So what is genetic counseling and why is it so important? Genetic counseling is the process of helping people understand and adapt to medical, psychological and familial implications of the genetic contributions to the disease. In the early 1970s, a committee of the American Society of Human Genetics, also abbreviated as ASHG, proposed a definition of genetic counseling that was adopted by the society in 1975. According to ASHG, genetic counseling is a communication process which deals with the human problems associated with the occurrence or risk of occurrence of a genetic disorder in a family. In simple terms, it is providing of information to prospective individual concerning the risk of genetic disorders in a family or in a future offspring by a trained person, that is genetic counselor, to help individual or family. The role of genetic counselor should be of increasing the normal and gifted population, at the same time decreasing the abnormal and deficient population in the society. Genetic counselor also will discuss various concerns about the condition they have or might be occurring in the future, various testing and their implications for both consultant and family. The counselor will go through all of the possible results of the test, what these results mean and provide with relevant data for an individual at risk to get more information and support. They also support consultant and family members to help find the options that is suitable for. So, who need genetic counseling? Individual or families may need to attend counseling for a number of reasons, such as family history of a genetic condition or chromosomal abnormality, strong family history of cancer, predictive testing for adult onset conditions, positive test for single gene disorder or birth defect, increased maternal or paternal age, abnormal maternal serum screening results or ultrasound findings, have had 2 or more pregnancy losses or baby who died, to get ready for a healthy pregnancy and baby. Now we will see what genetic counselor does. Genetic counseling is the process of providing individuals and families with information on the nature, inheritance and implications of genetic disorders to help them make medical and personal decisions. Genetic counselor deals with genetic risk assessment and the use of family history and various genetic tests to clarify genetic status of family members. The counselor also addresses all personal, cultural and ethical issues that individual may have to face with. For this reason, genetic counselors have many responsibilities and perform a wide array of tasks during counseling that consist of: first, ask questions about family, medical and pregnancy history. Second is explain chances of a genetic condition occurring or recurring within the family. Third one is talk about how genetic conditions are passed down in the family. Fourth one is recommend and order tests that can help diagnose a condition and explain test results. Next is discuss treatment options for a genetic condition. Sixth is help people deal with feeling about how genetic conditions affect their families. Next is answer medical questions and addresses emotional concerns. Next is explore reproductive options. 9. Refer people to other resources for support and managements. Let's start with first. Ask questions about medical, family and pregnancy history. In this, the success of genetic counseling is depending on the gathering of accurate, detailed and relevant information for particular condition. Genetic counseling should be given in a private and comfortable place. Moreover, it should also be obtained in an area that makes confidentiality. Informed consent should be asked always. According to the circumstances or time, it should be either in written or verbal form. Written type is mostly preferred one. An integral part of genetic counseling is of course the family history evolution. This usually is recording in the form of scientific manner with particular symbols, that is a pedigree making. So, as to clarify relationships and not phenotypic features, those may be relevant to the particular condition. Pedigree analysis has been shown huge potential to predict the risk of more common as well in multifactorial conditions. Additional family history of potential genetic significance that including paternal age, age of onset, ethnicity, consanguinity, infertility, birth defects, late onset diseases, mental disability should also be obtained as a matter of course. Next is explain chances of a genetic condition occurring within the family. Once a condition is known, the consultant needs to understand how it was arrived at and what the implications are for the proband's and other family members. This includes describing about the condition, its variability and its future scenario. Mathematical formulae such as probability analysis may be needed to incorporated by the genetic counselor, like Bayes theorem or Bayesian analysis, additional to understand future risks regarding the same. Third point is talk about how genetic conditions are passed down in the family. When a genetic condition is revealed in a consultant or in a family member, then an individual or family members often want to know the likelihood of that they or their children will develop the same condition. This is difficult to predict in some conditions because many factors influence the chance of developing a genetic disease. The most important factor is how the condition is inherited. The genetic conditions are passed down in a family by various inheritance patterns such as autosomal dominant, autosomal recessive, sex-linked or X-linked dominant, sex-linked or X-linked recessive. In addition, there are also mitochondrial as well. Co-dominant type of inheritance is observed in various other types of genetic conditions. However, estimating the chance of developing or passing on a genetic condition to their offspring can be complex or multifactorial cascade. Fourth is recommend and order tests that can help diagnose a condition and explain test results. Genetic testing should, as far as possible, be accompanied by genetic counseling. So, let us see what is genetic testing. Genetic testing detects variations in an individual's genes or chromosomes that are hereditary material. A variant, mutation or change in a gene or chromosome might be important if it is related to abnormal health condition. Intent of genetic counseling is to communicate various genetic tests, their options and risk to consultant. In this element, counselors can explain various tests available like diagnostic test. A diagnostic test is any kind of medical test performed to aid in the screening, diagnosis or detection of disorder. Second is predictive genetic testing. Predictive genetic testing is the use of genetic test in an asymptomatic person to predict future risk of disease. This test represents a new and growing class of medical tests differing in fundamental ways from conventional medical diagnostic tests. The hope underlying such testing is the early identification of individuals at risk of a specific condition will lead to reduced morbidity as well as mortality through targeted screening, examination and prevention. Prenatal testing. Prenatal testing is the test for diseases or conditions in a fetus or embryo in the womb of the mother before it is born. The another one is pre-implantation genetic diagnosis, which also abbreviated as PGD, is a technique used to identify genetic defects in an embryo created through a well-known technique that known as in vitro fertilization, also abbreviated as IVF, before pregnancy. PGD may be an option for some families in which the disease causing mutation has been identified prior. The next test is carrier testing. A carrier is someone that carries the disorder and can pass it on to their children but is not affected themselves. Carrier testing is a type of genetic testing that is used to determine if a person is a carrier for a specific recessive disease. Fifth part is discuss treatment options for a genetic condition. Many genetic disorders results from a gene change or mutations that are present in essentially every cell in the body. As a result, these disorders often affect many body systems and most cannot be cured. However, approaches may be available to treat or manage some of the associated signs and symptoms, such as dietary restrictions have proved useful in treating some condition. Enzyme replacement therapy is now available to treat some genetic conditions called inborn errors of metabolism. Experimental technique called gene therapy is a broader treatment that changes gene function at all. It uses genes to prevent and treats various disorders and diseases. Gene therapy, along with many other treatments and management approaches for genetic conditions, are under study in clinical trials such as stop codon read-through, exon skipping, and various other approaches. Coming to help people deal with feelings about how genetic conditions affect their families. In this, just giving information does not necessarily promote consultant autonomy. To complete successful counseling, it needs to empowering individual with information regarding genetic conditions or risk and to make difficult decisions with they are comfortable. The counselor needs to encourage consultant to look themselves as a competent and to help them project how various events or courses of action could affect them and their family. This can be done with knowing about their socio-economic condition, educational, cultural, emotional as well psychological parts. It is also important to make sure that depending on the above factors, the consultants are told about medical, surgical, social as well educational interventions that can correct, improve or stop condition. Next is answer medical questions and addresses emotional concerns. Genetic counselors don't just provide information. Another very important part of work is providing emotional support to the individuals and families during what can be challenging and confusing element. Psychological support should be given to patients when necessary to adjust them to a situation, to help them to cope up with stresses and to assure their individual decisions making. Patient psychological, emotional and social responses need to be taken into account during every part of successful counseling. Genetic counselor can also aid in meeting for a consultant with a special psychologist. Now we will see various reproductive options available too. Individuals or consultants who are carriers for genetic diseases such as familial Duchenne muscular dystrophy, sickle cell disease or cystic fibrosis, many more are at increased risk to have a child with same genetic conditions. Likewise, individuals who carry a balanced rearrangement of chromosomes are at increased risk of miscarriage or having a children with birth defects as well with mental retardation problems. There are several reproductive options available to couple who wish to have a children but are at increased risk for the above concerns. They can continue with family planning and pregnancy under observation of genetic counselor with gynecologist and have specific prenatal testing. During pregnancy, prenatal testing such as CVS, that is chorionic villus sampling at 10 to 12 weeks of pregnancy or amniocentesis at 15 to 16 weeks of pregnancy are preferred. In vitro fertilization, that is abbreviated as IVF, and pre-implantation genetic, that is PGD, of embryos prior to pregnancy. Egg or sperm donation. Screening the donor for the specific high-risk disorder is recommended. Adoption. Adoption is also one of the available options for the high-risk couples. Next very vital part is refer people or consultant to other resources for support as well managements. Most genetic disorders absorb lifelong care. Genetic counselors often serve as the touchstone for a consultant or proband. Genetic counselor coordinates their care amongst numerous specialties and supports them across the lifespan. For this, genetic counselor can select various disease specific and or support organizations and or registries for the benefit of individuals with the condition and their families for further managements and or follow-ups. The most rewarding aspects of genetic counseling is watching patients grow up, visiting patients with healthy offspring, or meeting with the family members to help disseminate genetic information to those at risk. In sum, genetic counselor provides information, offers supports, and addresses a patient specific questions and concerns. In addition to the above, genetic counselor will never tell a person which decision to make, advise a couple not to have a children, recommend that a woman continue or end a pregnancy, tell someone whether to undergo testing for a genetic conditions. The next approach is how might a consultation with a genetic counselor be helpful. So, now we have an idea that genetic counselors are able to outline potential risk associated with personal or familial medical condition and the possible risk to a pregnancy or offspring that may occur with a normal as well by use of assisted human reproductive options by a successful genetic counseling. Genetic counselors are trained to help determine who benefit from genetic testings as well can help arrange a testing for individuals who are interested or at risk for a particular condition. Hence, it is recommended that specialist doctors and healthcare providers are made referrals to a genetic counselor if there is a concern or necessity in pursuing genetic counseling. Summary. Let us summarize the topic. In this topic, we had discussed what genetic counseling is and its brief importance. Now we also know who need genetic counseling. We had also portrayed about genetic counselor and their roles. Moreover, we too pointed various elements that need to be considered during genetic counseling practice. We had also highlighted various tests, reproductive options available to high-risk individuals. Finally, we also come across an important points that genetic counselor will never does. Thank you.